Okay, let's dive into a really important clinical topic, one that has a huge impact on quality of life: female sexual dysfunction. We're going to frame this specifically for your pharmacy practice. So I want you to think about this for a second. Let's be honest, these can be tough conversations to start, for anyone, but they are so essential. This whole explainer is designed to give you a clear, actionable framework so you can handle these conversations effectively and, with compassion. So here's our game plan. We'll start with the basics, then get into the specific disorders. After that, we'll talk about your crucial role in figuring out the causes, look at the treatment options, and wrap up with some practical counseling points you can use right away.
All right, first things first. Before we can even talk about dysfunction, we have to appreciate just how complex a normal sexual response is. It's definitely not a simple on-off switch.
You can see here, sexual response is this incredible mix of psychological and biological factors. Now think about your daily practice: mood, stress, medical conditions, and especially medications. You're already talking about these things with your patients every day. This is exactly why you are a key player in this conversation.
Okay, so now let's get into the specifics. We're going to look at the actual diagnoses as defined by the DSM-5. This just gives us a common language and some really clear criteria to work with.
First up is FSIAD. This one's actually a combination of a couple of older diagnoses. It basically captures that persistent lack of desire or arousal. The key things to remember are the timeline — it's got to be going on for about 6 months — and that it's causing real significant distress for the patient. Next, we have female orgasmic disorder, or FOD. Now, this is different from desire or arousal. This is all about the orgasm itself. Is it delayed, not happening at all, or is the intensity just not there? And again, we're looking at that 6-month time frame. This disorder is a perfect example of how the physical and the psychological are just completely intertwined. It combines issues like pain during sex with the fear and anxiety about that pain, recognizing that you really can't separate the two clinically. And this brings us right to where you, as the medication expert, become absolutely vital. Because before anyone even thinks about a treatment, we have to play detective and rule out any drug-induced causes. Seriously, a thorough medication review isn't just checking a box here. It's a primary diagnostic tool. You are in the absolute perfect position to spot potential drug-induced sexual dysfunction that others might miss. And just look at this list. What's really striking is just how common these drugs are. We're talking SSRIs, beta blockers, hormonal agents, even some over-the-counter antihistamines. I mean, these are medications you dispense every single day. Your review is indispensable.
Okay, so let's say we've investigated the potential causes. What's next? Let's walk through the therapeutic choices, which will help us build a really solid counseling strategy. We can kind of split the approach into 2 buckets. The foundation should always be non-pharmacologic stuff. Think therapy, lifestyle changes, even simple things like lubricants. The medications are much more targeted and are really only for specific diagnosed conditions. So here's a simple way to think about the therapeutic path. Notice step 1 is all about treating other conditions first, like picking the right antidepressant. Step 2 is about addressing physical symptoms of menopause. And only then, way down at step 3, do we even consider a specialized agent like flibanserin. So if you ever see a script for flibanserin, a few things need to flash in your mind immediately. It's only for premenopausal women with FSAD. The efficacy? It's pretty modest, and it has to be taken every day. But honestly, the most important part is the interactions. This is the big one, the single most important warning. Mixing this drug with alcohol or even common antifungals like fluconazole can cause a dangerous drop in blood pressure and fainting. This isn't just a suggestion. It's a hard stop, red flag warning you absolutely have to deliver, loud and clear. Now, you are definitely going to get questions about testosterone. Patients hear about it online or from friends. The bottom line is this: current North American guidelines do not support its off-label use for low desire in women. The data just isn't there, and we have no idea about its long-term safety. All right, let's wrap this all up. Let's distill everything we've talked about into some powerful, memorable tips you can start using at the counter tomorrow. Your first step can just be to educate and reassure. Seriously, sometimes just explaining to a patient that it's normal for desire to change over time, to become more responsive rather than spontaneous, can be incredibly validating. Information itself can be a form of therapy.
And here's another huge area where you can have a massive impact. When a patient is also dealing with depression, treating that mood disorder is priority number one. Your recommendation to a prescriber to maybe try a more sexually neutral agent like bupropion, that could make a world of difference for that patient's overall quality of life. This is a key insight. For many patients, the physical machinery is working just fine, so a big part of your counseling can be to help them shift their focus away from a perceived physical problem and towards the context, things like stress, distractions, and the psychological side of arousal. And finally, it's so important to know your limits. Recognizing when an issue is outside your scope and guiding that patient to the right specialist, whether it's a psychiatrist or a sex therapist, that's a crucial part of providing excellent, comprehensive care. So as we wrap up, I'll just leave you with this question to think about. Reflecting on the barriers in your own practice can help you figure out how to weave this knowledge into your workflow and really start making a difference for your patients. Thanks so much for joining me for this explainer.